Welcome to my YouTube channel. Today we are going to talk about the anatomical snuff box. So the anatomical snuff box is a triangular depression found on the lateral side of the dorsum of the hand, and it is visible when the thumb is hyperextended. The borders of the anatomical box are: medially we have the tendon of extensor pollicis longus, laterally we have the tendon of extensor pollicis brevis and the tendon of adductor pollicis longus. Proximal we have the styloid process of the radius. The roof is formed by the skin and the superficial fascia. The floor is formed by two carpal bones which are laterally, that is the scaphoid and the trapezium. The contents of the anatomical box are: we have the radial artery, we have the cephalic vein, we have the cutaneous branch of the superficial radial nerve. So the cutaneous branches of the superficial radial nerve and the cephalic vein pierce the roof that we said is formed by the skin and the superficial fascia. Clinical significance of the anatomical snuff box. Number one, we have radial artery pulsation. So we can obtain the pulse of the radial artery by placing two fingers at the proximal part of the anatomical snuff box. The second one, we have the fracture of the scaphoid bone. So the scaphoid bone is the most fractured bone among the carpal bone. Since, as we have talked about, the scaphoid bone forms the floor of the anatomical snuff box, in fracture of the scaphoid bone, we'll have pain and tenderness in the anatomical snuff box. So sometimes the cephalic vein is used in administering intravenous fluids. So questions: which one of the following is not a content of the anatomical snuff box? We have cephalic vein, superficial radial nerve, median nerve, radial artery. So which one of the following do you think is not a content of the anatomical snuff box? Question number 2. Tenderness of the anatomical snuff box could be because of fracture of which bone? Hamate, trapezoid, trapezium, scaphoid. So what are your answers? So the answers are: median nerve is not a content of the anatomical snuff box. The tenderness of the anatomical snuff box could be because of scaphoid. Thank you for watching.